see my screen?
Yes.
Yep. All right. Excellent. Okay. All right. So, if you, I see others are joining. If you have background noise, go ahead and mute yourself. But if you have a question, please unmute yourself and feel free to ask. Okay. We're going to talk about common disorders of the cardiovascular system. All right. The first one we're going to start with is anemia, because anemia is really quite common. And you're wondering, well, that's dealing with blood. How does that have anything to do with? But if you think about it, if anemia means that you do not have enough healthy red blood cells. And what do red blood cells carry? Oxygen. So if you're not having enough cars to carry all of your oxygen around in, the oxygen's just not getting delivered. So anemia is a serious issue, and it's actually very, very common. It affects a lot more people than we realize. It is more common in women than in men because women have menstrual cycles. The most common cause could be a decreased production of healthy red blood cells, or an increase in the destruction of those cells. And then sometimes it's a deficiency from vitamins, minerals, and menstrual periods and internal bleeding. And believe it or not, some anemias are inherited, and some are brought on by really poor diet and toxins. But what you need to know and you need to write down is that anemia is basically you do not have enough RBC, red blood cells, in your body, so you're not getting enough oxygen everywhere. So that's the main thing. Now that we're going to break it down by the types of anemia. So the first is iron deficiency. This is the most common. You don't have enough iron, maybe because you have a really heavy period, or maybe because you're pregnant, or whatever, then you need iron supplements. So we see this as mostly the most common forms of anemia. Now the thing is, iron is one of those things you can't just start taking because, hey, I think I'm anemic, because you can do toxic damage to your body, especially the liver. So if somebody ever is curious, am I anemic, their best bet is always to have the doctor do blood work and find out if they're anemic, and if so, what kind. You can never start on supplements such as iron and so forth without checking with a doctor. Now, vitamin deficiency, this is what I have. It's called pernicious anemia, or you can just call it vitamin deficiency. It basically means where your vitamin B12, which is really important for hemoglobin, right? Red blood cell production. And you just don't have enough of it. As a matter of fact, mine was almost non-existent. Some people have trouble absorbing their B12. And this is when, because of the absorption deficiency, this is the pernicious anemia. This one can be solved by just taking B12. This one here means they're not going to get the B12 like they should, so we're going to need to give it other ways. And a lot of the time I was doing injections. So if it's not going to be absorbed through my gastrointestinal tract, we got to get it in other ways. So, but we lump this into one as vitamin deficiency. Another one, this is uncommon, is called hemolytic. And basically it's just another form of it. And we see this sometimes with lupus and lymphoma, different cancers. But it's really most common when you see people who have been exposed to toxins, like benzene or cancer-causing toxins. Hemolytic anemia is really severe, all right? Sickle cell anemia is also known as hemoglobin S disease. And whereas a normal RBC or red blood cell is round with a little concave indent for the oxygen to ride on, a sickled cell hemoglobin or red blood cell is not. It is literally shaped like a crescent or like a sickle. And here's the issue with that. When we have nice round puffy, oops, I didn't do that. Nice round puffy red blood cells, they slide and flow nice and freely through our vessels. With sickle cell, what can happen is they can get clumped and stuck, and it causes actually all kinds of issues, and it can be very painful. And sickle cell, we don't have a cure for it. We don't really have much that they can do. But in the last few years, they have found out that doing stem cell transplants, like blood transfusions with stem cells, are really benefiting and helping these patients. This is a more common seen disease in the African American population. So when, like, I'm a member of Be the Match, and if you've never signed up for it and you're healthy, please do so. I'm not healthy, I can't be a donor, but I sign up and I post on social media and I send as much stuff as I can, because what Be the Match is they do a little swab of your mouth, they keep it in a bank, and if there's like the chances winning the lottery like 3 times in a row, it's slim, that your DNA and your genetic composition is going to match somebody so well that you could be a donor. But if you are, you save somebody's life. So it's freaking amazing. And so I suggest, and I'll link that to y'all if you're interested in that. But because of Be the Match, they have been able to do treatment on these little kids, because it's a lot of times the little kids that are really affected with this. They've made amazing cancer treatments and stuff like that. So I'm gonna post that. That's my and I don't get paid by them either. It's just they're that amazing of a thing, an organization. But sickle cell anemia, and I think I have a slot. No, and that's gonna make me mad. Y'all know me. I gotta have my picture.
On the cancer unit.
I can't hear you.
Can you hear me?
Yes.
So for sickle cell patients, are they mainly on the cancer unit?
They could be, depending on what because other things start occurring, but usually like if they were going to receive some type of bone, because in the past they used a lot of bone marrow transplant. Well, that makes you susceptible, because they'll give them immunosuppressants to reduce the level of how likely it is that there's a rejection. So that you might see somebody there. But yeah, or a hematology, if the hospital's big enough and they have like a hematology section or something like that. But this is an example. We see a normal, round, concave red blood cell, and then a sickled cell. And you can see where this is going to be a massive issue. And I like showing the picture, because you see how this kind of flows nice and smoothly. But somebody who has sickle cell, it can cause for a lot of blockage. And I actually watched a video of a little girl. She was 9 years old, and she was talking about how sometimes she can feel it moving in her, and it just broke my heart. And so yeah, it's a painful condition, and they've been working on cures and stuff like that, but so far their best cure has been with the stem cells. All right, aplastic anemia is very, 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 very rare. And it's also the deadliest. It can be found in adolescents and adults, but the main cause of it is from pesticides, chemicals, also lead. There was before the America really started putting legislations down as far as paint and lead-based paint and that kind of stuff, we had a lot more cases of this. But what ends up happening with aplastic anemia is that the body literally is not making the red blood cells that are needed, and then the ones that do are deformed or abnormal, so it's like it's not even beneficial to the patient. The treatment for this includes medication, blood transfusion, and then of course stem cell transplants, and then finding out what caused it and keeping that person away from whatever it was.
What is a stem cell transplant or stem cell field?
I think what she said was, what is stem cell transplant?
Yeah.
Okay. All right. So our body, we're actually going to be talking about blood here in a few, so I don't want to give too much away. But stem cells are magic cells, and we learned a lot about them in the last 20 to 25 years. What we do, we know a couple of facts. One of the facts is that they can become any cell that they're put next to. So that means if I took stem cell and I put it next to somebody's dying cardiac tissue, it would become new, good cardiac tissue. If I put it by somebody's brain who had a stroke, I'm able to possibly regenerate that area. Stem cells are the future. Stem cells are basically where our future is headed. There's so many medical uses for them that it's endless. We possibly may be able to stop or completely slow down the process of aging with stem cells. We might be able to reduce most of our cancers because of things like gene therapy. And like I said, we'll get into this, but we've been able to do, our cancer survival rate has just skyrocketed since we are gotten into stem cells. Here's what the problem is. You're like, well, why don't we do it for everything? Because in the beginning, people were very against stem cells, because before we knew, the only place we knew to get them was aborted fetal tissue and placenta cords. So it was very controversial. And there were people that were like, oh, this is horrible. This is the worst thing in the world, blah, blah, blah. So you can see where there was controversy. So, but now we're able to take the fat from my gut and genetically change it back to its stem cell form. So we're able to make our own stem cells because how far we've progressed. So it's a lot more complicated than that, but I'm going to leave it with that. But basically, you say, what is stem cells? Stem cells is the future. It's legitimately, basically, we have all the puzzle pieces with it, but they're thrown on the table and we've just got to get them put together. But I literally, my personal opinion, if I could go back to school and learn anything, I would so go into that so quick, it'd make your head swim. But because I literally feel that most diseases and most issues could be cured and treated with stem cell therapy. But I'll share more about that later. All right, the next thing we're going to talk about is an aneurysm. Aneurysm, and don't know if you remember the last one of the lectures, I showed you like a little balloon. Let's see if we got a picture. No, of course not. I got to edit. Starting to anger me. All right, so let's take a look at an aneurysm. So there's different kinds, okay? So we have, basically what it means is the vessel has become weak. So it can do one or two things. It can just rupture, you know, like this, and you bleed out. And depending on where that happens, it could be life and death. Or it begins to form a balloon, and the balloon just gets larger and larger. But how much is a vessel going to stretch? We know there is elasticity, right? But how much is, you know, enough before it blows? So we try to screen for this. We try to watch for these type of things. But a lot of times, they're not something that we're able to catch. This is a beautiful picture. This is showing an aneurysm here, and I'm assuming this is the brain. And I'm guessing because it is intact, that it hasn't burst. So this person was just amazingly lucky. So they were able to go in there, probably surgically remove it and fix the aneurysm. And all of these, I'm trying to find one that already burst. It looks like this one did. But anyway, so that's what it is. It's a weakening of the vessel, and either ballooning or the actual rupture. Okay. And then let me go back here. So some people, they have a bad genetic lineup, and it's something they're born with. They're more predispositioned to having weaker vessels. Other people, it could be because of lifestyles and medications and stuff like that. We do know that high blood pressure, high cholesterol, arteriosclerosis, smoking, and all of those lead to higher chances of an aneurysm. Now, I know it seems like I have a story for everything. I'll give you, and I literally, with this, I do. This is very real personal. I had my ex-mother-in-law, my husband that passed away, his mother, believe it or not, is still alive. And she had a brain aneurysm in 1997. And she was on the phone with my husband at the time, and he noticed her speech began to be slurred. And he thought she was having a stroke. He immediately called the hospital, told them the things, and got an ambulance there. And sure enough, she had an aneurysm here that it was pressing up on major vessels, but she lived. And then my sister-in-law from that same family was 9 months pregnant and developed a splenetic aneurysm, meaning the vessel to her spleen ruptured, and she ended up losing her baby. She died. They were able to bring her back to life. She's still alive. And then my aunt died in her sleep from what's called a AAA, ascending aortic aneurysm. And the aortic is the largest, and she died in her sleep. Now, and then also, if you remember, there was a runner, an Olympian, Jackie Joyner-Kersee. She died of an aneurysm. Do you want to know what all those women had in common? They were on a drug called Fen-Phen, and it was a weight loss drug. And every single one of them women, and that's one of the things, they didn't know, or they said they didn't know, but it caused artery weakening. And one of the massive side effects was aneurysms. So like I said, sometimes it's genetic, sometimes it's lifestyle, sometimes it's medication. But it's one of the things that's really I would say like a 50-50. If you catch it, you could survive. If you don't catch it, it's really not much. I mean, once that, depending on where that aneurysm is, it's in your brain, that's not a really good survival chance. If it's anywhere near the aorta or that's not a good survival chance. Now, other places you might have a better, like limbs and stuff like that, you might have a better chance. All right, we're going to move on. We're going to talk about arrhythmias. And I think this is one of your Survey Monkey questions. What is an arrhythmia? Basically, it's when your heart that should be doing, PQRST, PQRST, PQRST in a certain pattern, very systematically and within a perfect synchrony and rhythm. Well, that's thrown off. It's not regular. So an arrhythmia is basically what you would write down is an irregular heart rate or rhythm, okay? So mainly the rhythm. Sometimes people who have arrhythmias, they don't, maybe before they're diagnosed, they might have fluttering or feel like their heart's racing. And some people have absolutely no type of signs or symptoms. Some people feel lightheaded. There's a bunch of different things. And but the bad thing is, like I said, some people are completely asymptomatic. One of the things that we do when we have our patients come in for their exams yearly is we do an EKG. And by doing this EKG, I told y'all what's a EKG that we do on people to make sure they're healthy? A baseline, right? We do that baseline EKG, so 10 years from now, if they develop an arrhythmia, we can go back and look through the years at their different EKGs and see what maybe changes occurred, right? But we don't want a patient to live or continue having an arrhythmia, okay? Because that means something's off. Now, how are you supposed to see that? All right, well, I'll talk to you about it. Tachycardia, and everybody should be familiar with this word. Tachy is what? Fast heart. So fast heart rate. And a tachycardia is when your heart is 100 beats per minute or higher. You do need to know that definition. Sometimes tachycardia has no signs, no symptoms. Usually it does. When your heart starts racing, you feel it. You can feel it in your carotid. You can feel it by the way you're breathing. You can feel it in other ways. If your heart rate gets too high, it can cause sudden death or a stroke or brain death. We tell our patients that who have tachycardia as an underlying arrhythmia, that they need to be aware of that. And there's medications that they can take and prevent these bouts of tachycardia. Some people usually, I had a student about 7 years ago, we were doing EKGs. And I said, who wants to be my volunteer? And Monique's like, I'll do it. So put her up on the table, hooked her up to an EKG, and her heart rate was, why does it keep doing that? Her heart rate was just really weird. She'd have like 80 beats per minute, and then it would jump to 160 for like 3 different segments, and then back down to 80, and then jump up 160. And that's called supraventricular tachycardia. So she was having bouts of that, and it was because one of her nodes were improperly firing and causing that. So she had to actually have cauterization, and where they go in and they burn part of the node to make it behave. There's a lot of, like I said, tachycardia is, if you're working out, you're exercising, you might experience tachycardia. That's just means 100 beats or more. So, but when it becomes symptomatic, when you become dizzy, short of breath, lightheaded, banging, where your heart feels like it's about to, pump out of your chest, those would be things we'd be concerned about. Now this is continuing. You say VTach because usually when we talk about tachycardia, it's dealing with the ventricles. So that's why I have VTach here. And many causes with this is coronary, high blood pressure, an enlarged heart, and this is a term you should be familiar with. Cardio, heart, right? Myo, muscle, pathy in the study. So an enlarged heart, right? So if somebody has an enlarged heart, that's going to increase their chances of having ventricular tachycardia. Certain valve diseases of the heart, and people who have had previous myocardial infarctions or heart surgery that left scarring, they may be at more risk as well. And this is what VTach looks like. And I can give you a quick paramedic glance. So as a paramedic, when I saw this, there's 3 things I'm looking for. Is it regular? Yeah. All right. Where's it coming from? Well, because you want to know, is it your atria causing your trouble, or is it your ventricles causing your trouble? This automatically tells me, do you see how wide this is? This automatically tells me this is coming from the ventricles. So that's quick, dirty, and fast. Now, if I look at this, I'm going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So that's 120 beats originating from excessive ventricular activity from the ventricles. So this would be VTach. So, and we'll learn more. Don't worry, we're gonna go more into EKGs and all of this good stuff. But you can see how what's kind of missing. You can see the P wave here, right? But it kind of gets lost. It's getting shoved up in there because everything's coming so quick, it's smashing it together. Treatment, there's a treatment for this is actually kind of cool. One of the first things I always did as a paramedic is I would tell my patient, I want you to, first of all, squat if they were capable, like literally on the, put their, hands on their knees and squat like they were trying to squat like, and I told them, I want you to act like you're taking a dump. Because, some of y'all may be familiar, we have a nerve called the vagus nerve, and it runs from the brain all the way down. And when we stimulate it, and one of the ways we can stimulate it is by pressing real hard, like a bowel movement. When we stimulate it, it slows down our heart rate. So that's why twisted-minded paramedics like myself had something we called commode codes, because we'd see a lot of old people who already had a slow heart rate on pain medicines that cause constipation. They'd be sitting on the toilet and they'd vagal out and end up having a heart attack. So on the toilet. So when we found them, they were on the, keeled over on the side of the toilet. But the vagal maneuver is very effective in bringing down the heart rate. So that would be the first thing we try. The next thing, if that didn't work, I'd try to get a bowl of ice water and have them put their head in the ice water. How many times have you ever been to a pool or a lake, ocean, and you jumped in and it was cold, and the first thing you did was, that was your vagal nerve being stimulated. See, we don't think about that. You're like, aha. So, so being exposed to that, so dumping somebody's face in a bowl of ice water can do that. Now, when all that else failed, I would pull out medications you don't need to know about and try a different few of them. When that didn't work, we pulled out and I'm laughing and I shouldn't be, God help me. We pulled out the paddles, because we'd have to do something called cardioversion. And it was basically, we would shock an alive wake person with a mild form of, not the same joules of electricity, but a mild form of this to tell their heart to get back in line. But that's just not a thing that you want to ever see anybody have to go through, because they hate you and you can't sedate them or do anything. So you're just basically shocking them, and you're like, it's for your own good, shock. So, but those are the different treatments for ventricular tachycardia. And this is when everything else hasn't worked, we resort to the barbaric cardioversion. Bradycardia is the opposite of tachycardia. Bradycardia is when we have a heart rate that's less than 60 beats per minute. Now, saying that, there are a few exceptions. If you are an Olympic athlete and your whole life you spend conditioning, and you can run 13 miles without even being out of breath, when you're chilling at home watching Netflix with your feet up, your resting heart rate's probably 55. And now, is that bad? No, that means that you are so in shape that your heart doesn't have to work like everyone else's. So we see that sometimes with athletes. Now, for me, I am not an athlete, but I have a low resting heart rate. I also have a low resting blood pressure. So it's my normal. So some people, even though we say 60 is just a number. Let's look at the patient. We don't, one of my things my paramedic instructor used to tell me was, we don't treat the monitor, we treat the patient. So, and what that means is, look at their symptoms. Are they symptomatic, or are they cool? If symptomatic bradycardia would be feeling dizzy or faint, feeling weak, feeling shortness of breath, confusion, right? These would all be symptomatic bradycardia. So that would be something that we'd have concern for. And there are medications that we can give these patients, but besides that, and fluids, other things, but besides that, there's usually an underlying problem. Like main thing is just being old. As we get really, really old, our heart tissues begin to age as well, and the heart slows down. Also, damage from a cardiac arrest, congenital defects, infection, myocarditis, infection of the myocardium. And this is a big one a lot of people overlook, is hypothyroidism. So I told you, everything's connected. So if your thyroid is not functioning properly, bradycardia might be a cause. But this is the big one. In a normal, healthy person, this is one of the first things I'm going to look for right here. I'm going to be asking them, have you been sick? Have you had the booty flu? Have you been throwing up? And these questions are going to tell me one thing. Have they lost electrolytes? Because one of the main common causes of bradycardia is dehydration. All right? So that's easy to fix too. But the doctor would have an IV put in and give them fluids, right? And then there's other bunch of different reasons, but the most common one, besides old age, is dehydration. One moment, please. Hello? 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 Yeah, I